Hello, and welcome to the Care Machine Sustainable Healthcare Podcast. I'm your host, Professor Helen Mees. In 2026, the conversation around corporate responsibility and global reporting in healthcare has become both urgent and sophisticated, especially within the NHS supply chain. With the NHS committed to achieving net zero direct emissions by 2040 and supply chain emissions by 2045, the medtech sector now finds itself at the epicentre of this transformation. Over 71% of the NHS's carbon footprint is generated by purchased goods and services, making the role of medtech and supply chain partners absolutely pivotal. This evolving landscape brings formidable changes. Medtech companies must now navigate a complex regulatory environment with requirements such as the Evergreen Assessment becoming mandatory from April 2026. Only suppliers meeting Level 1 sustainability standards will be eligible for NHS contracts, while annual carbon reduction plans and transparent Scope 1, 2 and 3 emissions reporting are no longer optional. Additionally, the sector faces heightened scrutiny around ethical sourcing and modern slavery, with major suppliers required to achieve a minimum of 40% on the Modern Slavery Assessment Tool, MSAT. Yet these regulations also create significant opportunities. Medtech innovators are responding by investing in digital traceability, life cycle analysis, and collaborative supplier networks to improve both environmental and social outcomes. Companies that can demonstrate verifiable reductions in carbon emissions, waste and resource use are gaining a competitive edge as NHS procurement increasingly favours those who can deliver measurable societal value alongside clinical excellence. There's a growing appetite for partnerships that drive systemic change, whether through sustainable product design, circular supply models, or transparent data-driven impact reporting. As the NHS and its suppliers adapt, the medtech industry stands at a crossroads. Those who embrace this new era of responsible business will help shape a more sustainable, resilient healthcare system for the UK and beyond. In part 2 of this double episode on sustainability, corporate responsibility and global reporting, I chat with Chris Taylor, Sustainability Lead UKI at Phillips Health Systems. Chris, an engineer by training, has worked in the medical imaging business for over 20 years, and in that time his concern for climate change and the effect the medtech industry is having on the environment has become a fundamental part of his ethos. For the past 4 years, he's been helping to drive the responsible and sustainable growth at Philips UKI and actualise its ambitious climate goals by improving people's health and well-being through meaningful innovation, which is positively impacting 2 billion lives per year, as well as creating a more sustainable planet for future generations. In 2022, Chris took up the role as convener of the Sustainability Special Focus Group for ACSREM, the trade association representing the suppliers of diagnostic medical imaging, radiotherapy, healthcare IT, and care equipment in the UK. He's also Vice Chair of the Health Tech Ireland Sustainability Working Group and a BSI committee member. And he also finds time as an industry spokesperson on the DHSC Design for Life project. Chris began by sharing his motivations for leading sustainability at Philips in the UK and what challenges the company face in terms of managing their own CO2 emissions. Chris, thank you for joining me today. It is wonderful to have you on the podcast.
Thanks, Helen. No, it's great to be here. Always a fan, as you know, so it's great to be working together again.
Now, Chris, you are the UK and Ireland's sustainability lead for Philips Healthcare. Now, that's not just a role that you fall into, right? That was a big journey that you've been on. So how did you get from your early training in engineering to sustainable healthcare?
Yeah, no, it was. It took a while. I'll be honest, Helen. We, I, well, most of my background's been in engineering, as you said, like service engineering, across of a number of fields. Last 20 some in kind of healthcare, medical devices, that arena, all across Europe. But in the background, I've always had a big interest in kind of climate change from a personal perspective, and I've done a bit of work with charities in my local area that look at kind of peat restoration, and that's as a big hiker. That's basically how I started. So I was doing this in the background, and then let's accelerate about 5 years forward to 2020, and Sir Simon Stevens writes his first report, and the agenda's then set to be the first health care institute to become
Yeah.
net zero by 2045. So I'm reading that and I'm thinking, this is great, this is really aligned, but I wonder what we're doing within Phillips. And I knew by then what we were doing in Phillips, but how, from a UK perspective, UKI perspective, how that worked. So I spoke to Charlie McCaffrey, who was the DGM at the time, the man in charge, and said, I don't know if you're aware of this, but this is really going to impact on our business moving forward. Who shall I speak to about getting this moving forward and supporting this agenda? And I think I remember his reply was, "Good question. You was the so from that point onwards, I started kind of taking a bit more interest in the kind of healthcare aspect of it. Um, at that point, through my work with AXREM, which is our main trade association, and Sally there, we were getting quite a lot of questions. So at the time, Charlie was in charge of AXREM. So he asked if I would support AXREM as well. We were like moving to COVID days there, but I was trying to support AXREM the best I could. The dialogue that we were getting became very clear that by this point we needed to actually look at setting up a focus group. And so myself and Sally discussed this, set that up, and I think it was only right that if I helped set that up, then I had to step up and convene that. So started convening for that one. At the same time, I'm still doing engineering. I was a service manager back at the time at Phillips, so we continued that work. Mark Leftwich then kind of took over, and he's been a fierce supporter and advocate of sustainability within healthcare, and was really supportive of the kind of role that I was doing, and also helped me, give me the time to throw at this. Yeah. Because that's the biggest aspect, is how much time it needs. And I soon, over about 2 years, I think it was a 7-day week, constant at this point. So it was getting quite hard, and it was more the kind of second job was taking over from the first job. And so I basically said to Mark, I said, look, I'm not doing you justice either way. We probably need to really, sit down and look at this and see what's happening. And he said, yeah, give me 2 months. So carried on 2 months later. And this was probably about this time last year, so a couple of years ago. And then in 2024, 1st of January 2024, it became a permanent position. Wow. Which is really good, because I'll be honest, if there was 6 of me, I think there'd still be enough work for this role. One of the hardest things at the moment is just keeping up with demand, despite the geopolitical arena that we find ourselves in. The NHS are still very keen to move forward, and globally, there's still quite a big support for it. So yeah, it's a growing an industry, but without a shadow of a doubt. So yeah, it was. It's great. It just shows, within Phillips how kind of proactive they are in this arena, but also, if you kind of prove yourself, that they do reward that. So great from Phillips' perspective.
Yeah, and I think you make a really good point there as well. The issues around sustainability within healthcare businesses and industry, it's not just an add-on, is it, Chris? It's you have to dedicate an awful lot of time to it, and it's great that Phillips saw that as an opportunity to create a dedicated position. that you could then take it on full time.
Yeah, definitely. And to be honest, it's even now I'm having to say no to more things than I would like. It was just kind of shows you the kind of
Yeah.
market we're in. I would love to be doing a lot more, but unfortunately, just there's only one of me. So we can do what we do and support what we as many projects and to be fair, I like through AXREM, which obviously keeps me very busy. The industry perspective, we work, very closely with like the SME community and try to support them as well in this journey.
That's definitely something I want to talk to you about in the podcast. So we'll definitely come back to that as a subject. But I should get Sally on the podcast, shouldn't I, and have a chat with her about AXREM because they do a lot to support the industry as well.
Yeah, no, she's worked tirelessly. We're over 100 members now, which I think when she started, I think it was about 20 or 30. So it's really been inspirational in growing AXREM and its kind of reach and the work
definitely.
we do.
Now, Phillips is an internationally renowned medical and healthcare technology organisation. I mean, everything from toothbrushes to MRI scanners. So what kind of challenges does that generate in the context of CO2 emissions and sustainability?
Yeah, I mean, we've been, I would say, really proactive in this arena. It's when you look into the history, it's hard to believe, but we actually started this process back in the 1990s, where we moved into kind of eco-design philosophies. And then the vision then was about as much about kind of stabilizing supply chains and the potential impact that climate change will have, and as we've seen, has on your supply chains. If you looked through COVID, how impactful that was on everyone's supply chain. It had a massive roll-on effect. And so it was some really great kind of forward thinking at that time to say, look, we need to start, embracing this more circular economy. We were working with like the Ellen MacArthur Foundation, University of Essex at the time, Exeter, at the time. And, in bringing that into the whole ethos of the company. So when we're designing a piece of kit, it's not just thinking about, its energy use. We're looking at the raw materials we use. Can we eliminate them, all those, horrible plastics that we that are very popular to talk about these days? Can we get rid of these chemicals? Can we use less? Weight was one of our measures, believe it or not, in the design process. Seems a really odd one, but if it weighs less, then you're using less raw material. So it actually is a good measure for that. So that's why we have that as one of the criteria. And the idea is that, yes, we've got some great innovation, especially like if you look at MR with the Blue Seal that uses 7 litres of helium compared to 1,500 litres, which is what a traditional one uses. But innovation alone doesn't get us there. There's other things that we need to do as part of that. And we've embraced that as a company. We continue to report the highest level when you look at kind of the moves in corporate sustainability reporting directive. We've continually moved forward that we're being audited at the very highest level. I know the CSRD's taken a little bit of a dubbing over the last year with obviously the US. We're not going to that one, but obviously the US. But we've continued to kind of report at that higher level. So I think holding ourselves up, and we're not perfect. There's certain areas that we're still working on. We continue to take the feedback and continue to progress. Yeah, so I think it's great that we are that open to to the thinking around sustainability. It's still a core kind of aspect of our business that we continue to push. But it is more challenging these days without a shadow of a doubt.
Yeah, and I bet your engineering background comes in really useful as well from that point of view. To be able to look at this holistically, to look at the systems of systems that make up the products that you develop, it does go beyond the device itself. It's a huge interconnected network, isn't it? And it's something that I think as an engineer, you bring that kind of brain to the problem, and it must help you an awful lot to have that engineering background in solving some of these problems.
Definitely, that system approach, especially, is something that's very popular thinking these days when we're looking at sustainability. But yeah, you do tend to come at it as an engineer. You know the bits that input and you know the bits that output, and you're still using that kind of, it's a piece of kit in my head sometimes, the way that you kind of
Yeah.
think about it. And I'm still, thinking of like the ways to move forward in the same kind of manner. I think you can't take the engineering out of something
You
that's done it
certainly
for
can't.
so many years. Yeah.
I would definitely agree with you on that one. So let's move on from identifying the challenges to how you go about tackling them. I mean, there are multiple issues. I mean, I don't know exactly where you start on this, but what's the process that you undertake to build sustainable thinking into the business? Is it a strategic kind of decision-making process, or is it operational in nature, or is it kind of a bit of both and a mixture of all different things?
Yeah, well, yeah, it's a mixture of everything. As much at the moment, what we're trying to do or get across is the fact that sustainability is integrated into everything that you do. So it's not a silo that we bolt on, because when you look at it that way, it always
Yeah.
looks like extra work ultimately. And the one thing we're trying to get across is it's not extra work. If you think of it properly, and I always say this is where people from Yorkshire come in really good when it comes to sustainability, is that it's all about saving really. Yes, that's not always the case, but we're looking to reduce waste. We're looking to eliminate things like carbon, obviously, but other items, use less materials. So we integrate sustainability into everything we do, and up to now, we've done a lot of this through collaboration. So there's been the last few years is just talking with people, looking at their approach to sustainability, how they integrate that, rather than this silo approach, because everybody seems to have done it a little bit on a silo up to now. And we're saying no, let's look at it. Wait, you can't do it that way. It's you're busy enough. How do we integrate it into your day-to-day work? And where it's been really successful, we've seen that integration work well. So that collaboration piece has been key up to now. What we are now seeing though is the need for education, especially within our arena, with all the kind of geopolitical aspects that they're out there. Then we have to be 100% squeaky clean these days. So that means ensuring people have the latest knowledge, that they're well equipped, that they have the tools, for want of a better engineering framework, to kind of help them move forward and understand the problems that we're up against. Once you've got that, that gives you a great start to start
Yeah.
addressing the issues, which are many, as you say. But I think the biggest thing at the moment is just to get people thinking about it and integrating it that way. Once we see that started, that process kind of drives itself then, and we certainly seem to move things forward within within the UK. Obviously, we've got things like the NHS roadmap to net zero, which is a big part of everybody's work. So that does help kind of give us direction. We know what we've got to do from each of the milestones. So that does kind of help direct us. But integrating, collaboration, education, those are the tools for
Yeah,
helping us
yeah,
move forward.
and I think you're right as well. The issue around education, it's sort of sifting the wheat from the chaff, isn't it? And making sure people have the right information, that they're not being bombarded with extraneous things that aren't necessarily relevant to the business, but to give them really strong direction as to what the requirements are, so that they can almost live by that rather than it just be an add-on.
Yeah, I mean, there are numerous challenges that we need to address, and you can't, there's not one silver bullet. There are numerous ways that we take this forward. Circular economy, for example, is a big part of that, but you can't do that. It's not the only part, but educating people in kind of circular economy is, probably an area that we still need to drive. The term is used quite a lot, but it's still an area that people still see as a costly exercise, which is actually the one thing that circular economy
Yeah.
tries not to be. It's all about eliminating waste as much as possible. So it's actually, if you embrace circularity, it's actually meant to be anything other than creating,
Yeah, I
extra
think you're
cost.
right, and the issues around people seeing it as a cost to the business as well. I think that's something definitely that we need to educate people around. Yes, initially there might be some additional funds that need to get these things off the ground, but the long term goal is to reduce the cost to the business, isn't it?
Yeah, I mean, definitely. And the one thing I always try to get across is the longer you leave it, the more
Exactly.
costly it's going to
Yeah,
get.
yeah,
So you only have to look at what the kind of latest science is. We're moving away from climate mitigation
yeah,
into climate adaptation now, which is, we've for years we've been in the boat. We know we've got a few holes in there. We've been trying to plug away at the holes. Unfortunately, we've got to the point now that the boat's quite full, so we're having to bail out the boat as well as
yeah.
fix the holes at the same time. So that's the analogy I like to use of where we are. So we really need to, start addressing this because it will get costly. If you look at what to do 2 degrees means, it's a lot worse
Yeah.
than what 1.5 is. And that will involve, cost for everybody. Not, you look at patient demand, that's only going to rise. You look at effects on supply chains, that's only going to increase. So the quicker you adapt, the more stable
Yeah,
you're going to be long
definitely.
term.
The environmental, social, and governance standards, they play a key role across the whole of Phillips's business. And in fact, it's the fourth section in your annual report after finance. So it clearly is a big driver for the company. How do you, as sustainability lead, embed the ESGs into the healthcare business ethos, and how does that translate into global reporting processes?
Yeah, I mean it's been a key part of Philips' kind of growth for like I say, going back to the 90s, and we've been really open with our approach to it. The link to the ESG page is probably one of the most frequently used and frequently given out uh, pieces of information that we use in most presentations. So I think that having been open on our approach there has been a big part of that, and it has helped kind of drive the agenda forward without a shadow of a doubt. I think now we're looking at where do we go next with ESG? Is it as a kind of a responsible corporate company? What's the next stage? Do we look at kind of more community value, our place in, if you look at kind of that double materiality piece where we talk about, Philips' effect on the environment and the environment's effect on Philips, we're looking kind of beyond that now, if you think about any company these days, what its impact is on like biodiversity, on the local communities that it interacts with. And I think we continue to keep ESG at the centre of everything we do, and it is without a shadow of a doubt, a place that's key to Philips' success. We want to continue that kind of growth and look at Philips' position globally and our effects, our interactions both ways with the wider environment. So I think that will continue despite like I said, the geopolitical challenges. We're still committed to that moving forward, and I think it is it's key to Philips' success. We've been doing this now since, like I said, the early 90s, and if you look at the projections moving forward, then starting this process early has really been, a great foresight. From Phillips' perspective, you've got to kind of admire that forward thinking. I think horizon scanning as well is going to be equally as important. I think as we move probably past the next 4 or 5 years, it's going to be interesting to see what direction things take. Obviously, there's a lot of issues that are out there, not just from a climate perspective, but supply chains, etc., and what impact that's going to have on the industry. So yeah, it's great that we're continuing that focus.
I asked Heidi in the last segment when we were talking, how do you ensure that your sustainability strategy can be achieved by your supply chain? And in light of NHS's Evergreen Assessment and what you've just said about the ESGs, how are you transmitting your own strategies onto those of your suppliers? And what can smaller companies in this sector learn from Phillips's experiences?
Yeah, I mean, it's projected now, isn't it? 71% of your emissions are down to your supply chain, so it's a massive impact. And funny enough, it's been part of one of our main goals for the last 5 years, is helping our suppliers move forward. So we have a target that 50% by the end of this year, 50% of our suppliers will be on the SBTI framework. We're at 49%,
excellent,
something like that. So we should hit that. But we've actually won, or we've actually been accredited by like CDP for our supplier engagement program. So we use that to help move, because your supply chain is a massive impact, and as Heidi will know, especially with the unbelievable amount of supplies that they have to deal with, it's just unbelievable to even start to think of what Heidi has to deal with. But yeah, so it is an integral part that and this is what I quite like about this whole sustainability piece, is that it's the sum of all the parts coming together, and how I interacting to Heidi, but then somebody else interacts to me, and with that link of especially around carbon emissions, is such a big system that you have to kind of take an innovative approach. And I think again, this is where there is within the ESG page, if you go do a bit more digging, you'll find a supplier engagement program, which we've actually demonstrated to the NHS England team a few years ago, and they were blown away by that work, and that has really helped us move forward. And I think that's what people are trying to get to grips with now. It's such a big problem for everybody, and it's a hard one, because let's be right, if you've got a supplier the other side of the world, how do you know what they're doing? How do you get that information back? Because it's inputting into your system, and it is a challenge. But we've took the top 50%. That's how we've done it based on spend, and that's working well for us. So at the end of this year, we'll have finished our second 5-year program. So and we're well on track to hitting some of the targets we've already met. So at the end of last year, so it has worked well. But yeah, that supply chain engagement is a difficult one, and we have to appreciate that. But again, sharing practices that have worked. I'm not saying best practice, because I think you can always make things better, but certainly it's been very productive for us, and engaging that supplier program has been really, really positive. More information.
The issues around education, as you talked about before, but also sharing and being open and transparent about what works, what doesn't, I think is the key message, really, isn't it? Ultimately, is as big as Phillips is as an international company, there's still lessons that you can share with smaller companies, and particularly when we talked before about this, people seeing it as an add-on and not as an embedded process within their companies. Small companies can really suffer from that, can't they? And to know that there are methodologies, that processes out there that other companies or are fine-tuning, that they can learn from. That's a really important message to get across, isn't it?
Yeah, and that's where our work with like Axrem is really, really, fruitful. We've got a big SME community there that, we work with very, tirelessly to support. There's a number of kind of webinars and things that, they're all free, that support package. So helping people understand that big picture is definitely key. And if you're an SME, I can certainly, it is a big challenge when, you've got a finite workforce there. You've not particularly got a Chris Taylor that's permanently doing that job. You'll be doing the service job and probably about three other hats at the same time. So it is difficult. So, as you say, education, integration. We're hoping by the first quarter of next year to bring out kind of an educational framework that will kind of get everybody from novice to kind of fellowship. Oh, that's the aim. Within the kind of first quarter. So that'll be coming out. So hopefully that will also help. After with our friend Richard Hickson, who's set up a great platform, CDP Match. I'll give him a shout out there. It's a free website. You can go on and learn loads of things about healthcare and sustainability. So we're hoping to use that plus a few other more structured courses to get people on that route.
Well, I can happily say that the Care Machine is on Richard's website, so we're part of that whole process as well, and it is a great tool for finding out what's going on across the entire sustainability network. So I'll put another link to that in the notes as well. But we've had Richard on the show as well, so he's shared quite a lot about what he's doing, and we'll definitely share that with our viewers as well. So thanks a lot for that, Chris. Now thinking forward, thinking to the future, I suppose the world is clearly having to deal with a myriad climate crises. What do you and Phillips hope to contribute into the future in terms of addressing corporate sustainability and helping society to alleviate environmental impacts? It's a big question, I suppose.
Yeah, I suppose it's that, what's coming next, which is always the thing about climate is a lot of it is kind of weather related, which is probably one of our hardest things to understand, and the impact that has. So yeah, what other challenges are we going to have to address? I think there's going to need some kind of flexibility around that. But I think if we establish our kind of foundations, you build in this circular economy process, start to move away from capital purchase kind of ideals, more into this, circular economy modelling of business, stopping your Black Fridays, where it's just a mass consumption of tack, for want of a better word. I'm not saying it's all that, but we just mass consume. We're at kind of 1.7 planets worth of annual renewables that we consume, and the kind of rise of the middle class, it continues to go up globally, which are seen as the big consumers. So that's moving to more like 1.9's worth, within earshot of us. So we really need to, move away from this consumption, that consumption is a kind of grading of success, because it's not, it doesn't bring you happiness. It's long life, happy life is what it's all about. And I think ultimately, this sounds a really odd discussion, but we're not. There's a few phrases that people say to me. They'll say you're trying to save the planet. And actually, I'm not trying to save the planet, because the planet will save itself no matter what we do. In about 50, 60 years, the planet will still be here, regardless. We only have to look at kind of things in COVID, and when COVID kicked in, and I know in Sheffield where I live, we had deer in the middle of the city within a few weeks, which just shows you how quickly nature adapts. So that is kind of one area that I think we need to understand. But also there's we really need to kind of think of our position within that. My ultimate ambition is to make myself redundant, because I think ultimately, if I don't have a job, that means the job's done. So fingers crossed. I think we had this conversation with a few of us who work in this area, that is the kind of ultimate vision, is to make yourself redundant, which is probably a very unique position for most people in this world. Unfortunately, I think that's not an easy task, and there's probably at least, even if we started addressing things tomorrow, if we could turn the carbon tap off tomorrow, in about 300 years, sea levels will still be rising. There's still going to be challenges to address. So, unfortunately, I think this role has got legs for a considerable amount of time.
I would suspect that it is an intergenerational job rather than one that you or I will ever see finished. But all we can hope for, I suppose, is that we can at least start the ball rolling now, if it's not too late, and ensure that future generations can manage to address what our predecessors have started. So it's a long process that we have to commit to, as opposed to see it as a job.
It's a kind of we've set a goal that we will never see, which is, I suppose, kind of frustrating, but then also quite I don't know what the words I would put it, but it's quite an enthralled, kind of visionary kind of place to start. Hopefully we're starting the world on a better future, which, come when these future generations come around and say, okay, what did you do? Say, well, at least, we started the ball rolling, and, we've got
That's very philosophical for this time in the morning as well. Chris, it has been an absolute pleasure to have you on the podcast. It's always enjoyable to talk to you. Thank you very much for sharing your experiences and your insight into what is quite a complex problem and a complex issue for many companies, these issues around corporate responsibility and global reporting. So I really appreciate your time today. And I think both of us now need to go and have a lemsip, because we're both full of cold, aren't we? And feeling rather miserable. So I think we've done our bit for today. So thank you very much for joining me, Chris.
Thanks, Helen. Always a pleasure.